Hi, my name is William Carter. I'm a Senior Officer for WASH and Emergencies at the Federation Secretariat in Geneva. I'm going to talk today about some very key concepts and principles that we find very important in WASH and emergency response. I'm going to talk a little bit about the tools and the different resources we have to carry out that response. And finally, I'm going to talk about how we work and engage with other sectors to have a really good complement of services and activities in an emergency response. First, let's start off with some really basics about WASH in emergency response. One thing that sometimes creates a little confusion is the name itself, WASH. We used to be called WATSAN or WATSAN HP. I'm wearing an old shirt that still says WATSAN on it, but it's all the same for us and it's really not that important. What's key is that we have all the different elements of water and sanitation and hygiene promotion in our response operations. The first thing is when we have a WASH activity or a WASH component of an operation, it's really important that we have WASH people on the ground because we really need technical expertise doing that assessment. Balance between software and hardware. So if I see a proposed activity where we're going to do a lot of software, a lot of hygiene promotion around, let's say, hand washing, but there's no facilities to actually wash your hands at, we're going to block that because we need to see that balance. People need the means to take action. Another aspect of balance that we really push on is between sanitation and water. So what we don't want to see is a plan of action where it says at the top, 20,000 people are getting water, 20,000 people are getting hygiene promotion, and only 5,000 people are getting sanitation. This is really not acceptable for us. We have to see either a balance between the two or a really good reason why not. So those are really our key principles. WASH is a health activity, and we need to see balance between hardware and software and sanitation and water. It's also a very complex activity. Maybe sometimes we make it look simple, but we have to have WASH experts on the ground. There is a lot of WASH in emergency response, and it is a big part of the kind of activities that we undertake as a movement, and so we have to have a wide array of tools. We're quite happy to say that we have a lot of different resources available to respond to disasters. We can't just have tools that only work for big ones, and we can't just have people that are only good at small operations. So, first of all, think what you have in that country. Obviously, a lot of national societies are already extremely strong in water and sanitation. They have people in their headquarters who are WASH advisors. They have people at branch level. Sometimes those are dedicated WASH advisors. Sometimes those are volunteers. And we want to use those people because they'll be there faster, they'll know the context, and they'll really be able to do a quality response. We have people at regional level. We have regional WASH advisors. We have people who are trained at regional level who can deploy regionally. We also have, of course, the WASH advisors here in Geneva. If there is an emergency operation, we can make decisions and provide the support that's necessary. One of the things that we have available to send out is the emergency response units, the ERUs. This is obviously one of our most well-known, most high-profile pieces of equipment and the people who go with it, but they are really for large-scale disasters. The saying that we have is that if your disaster is not on BBC, it's less likely that you're going to get an ERU. That's not always the case, but the fact is the ERUs, because they are deployed globally, because they are deployed by airplane and are therefore a little bit more expensive, they do tend to be more used in large-scale, high-profile disasters. But as I said before, the vast majority of our operations are very small scale. They may not be on BBC or CNN. And so that's why we've also pre-positioned equipment at regional and country level. We have something called WASH disaster response kits. One is for 2,000 and one is for 5,000 people. These are pre-positioned equipment packages sitting in regional warehouses or in sometimes national level warehouses, sometimes within the national societies. They're comprehensive. They do water, sanitation, and hygiene promotion. And they're really important for deploying with people either at a national or a regional level. The ERUs are bigger and they tend to be a bit more specialized in terms of either focusing on water or sanitation. So we have 3 different modules at the moment. The water modules are called either the M15 or the M40. In general, they're targeted for either 15 or 40,000 people. We also have something called the mass sanitation module that can provide sanitation services for 20,000 people in an emergency. A few considerations on those units, because I think this is really critical. Just because we have an M15 for 15,000 people doesn't mean that every disaster of around 15,000 people is an appropriate place to send in an M15. The primary consideration for deploying a water module is the density of the population in the affected area. If you've got 15,000 or 40,000 people in one place in, say, a refugee camp or a small city, these tools are really, really effective. It's the distribution of the water that's really difficult. So if we have 15 or 40,000 people that are quite spread out in a flood, a drought, something like that, these tools are probably not the right fit because their ability to distribute that water is quite limited. You're talking water trucking, which is very expensive and also very difficult to reach remote areas. So if we did have a large operation, let's say we had 40,000 people, but they were really spread out, we would tend to look in a different direction. We would think about rehabilitating the infrastructure that's there, fixing hand pumps, things like that. And in the immediate term, we would think about something called household water treatment. This is giving out to people chlorine tablets or filters or other chemicals which enable them to treat their water themselves. This is really effective in a flood where people have a lot of water, but they don't necessarily have the means to make it clean. So we can enable them to treat the water themselves. In doing that, though, we have to make sure that people are trained on how to use them, and we have to do follow-up. This happens time and time again where we do really big distributions of chlorine tablets, and then we go back a month later and nobody's using them or they're not using them correctly. We had an operation a few years ago where we brought in a researcher and she looked at the operation, and the percentage of people who had clean drinking water out of the people who had received the chlorine tablets was in the single digits, 8% of people or less. Our mantra on this is no distribution without training. We have to be at the point of distribution. We have to be demonstrating to people how we use these products, and then we have to go back afterwards very quickly. I'm not talking a month later, I'm not talking 2 months later. The next day, going to their house and talking to people. Are you using the product? What do you think of the product? Taking a sample of their water to make sure they really are using it. It's that kind of follow-up that will ensure that people actually have access to safe drinking water. On sanitation, there's some similar considerations. Population density is part of it, but our primary concern and what we take into account when we're talking about providing sanitation is what people want and what is the natural environment, what will that allow? And so in terms of the natural environment, what we're really looking for is soil conditions. Can we dig? If we're in a big city where people might be camped on pavement, or if we're in an area with a really high water table, digging may not be possible. When that happens, it's not just slightly more complicated. You don't just need a slightly different latrine, it's exponentially more complicated. You have to build a different latrine that is able to contain the waste. You then need to empty that latrine, and now you've got a truck full of human waste, and it has to go somewhere. And it goes back to what I said in the beginning, we really need good qualified WASH people in the operation as early as possible who are making decisions on technology choice and how we're actually going to do these things. Another part of sanitation that's really critical is what people want. If you pour water out of the tap, there's a few people who might not like the taste so much, but particularly in an emergency, they'll be happy to have that water. Water's fairly universal when it comes to what people want. Sanitation, very different. Whatever toilet you have at home is probably not the toilet that is favored by the vast majority of the people in the world, no matter where you're from. We don't know what someone from Sudan versus what someone from Indonesia wants. If we rush in and start building latrines that we think people want, they're not going to use them. Then we're going to have human waste on the ground, and very quickly we're going to have a disease outbreak. So talking to people, seeing what their preferences are and what their needs are is really critical. That said, what people want and what we can deliver particularly quickly in an emergency are not always the same thing. And that's why it's really important that we have both engineers and hygiene promotion people working in the same team. We like to say, tie them together at the hip, put them in the same Land Cruiser. Make sure that they're working together, that the hygiene promotion specialist is able to talk to communities and see what kind of toilets people want, but the engineer is also there saying, well, this is what we can actually provide with the resources that we have now. It's that kind of combination, that kind of working together where we see a really powerful emergency response operation in terms of WASH. Outside of the country, we have resources at the regional level. We have regional WASH advisors who are available to give technical support and in some cases can deploy. We also have regional tools. At the moment, they're called regional disaster response teams, or in the Americas, the regional intervention teams, the RITS. We've put a lot of emphasis on training WASH people in the RDRT and the REACH system. So this is one sector where there is a large amount of people available for regional deployments. Finally, I want to talk about linkages to other sectors. And we do have a lot of overlap with different sectors. I'll start with the most obvious one, health. We work very well with them, but it's important to remember that health ERUs are standalone. What that means is that they bring their own infrastructure, their own technology to both treat and distribute their own water inside their health center. So a WASH ERU is not responsible for providing water or sanitation to a health ERU. They should be able to treat and distribute within their health center their own water. That said, if the health ERU needs a hand, there are WASH people there who are available to support that. Same thing goes for the base camps. We expect them to be able to produce their own safe drinking water and provide sanitation. That said, WASH resources that are in the area should be asked for help if needed. Another area where WASH and health work together is on the use of health information. Cases of diarrheal disease or other outbreaks, any spike in any kind of cases like malaria, any kind of diseases that are caused by basically environmental factors. I consider that the responsibility of the WASH team. They may not be the only ones, but they have a role in addressing that. And we get that data from our health colleagues. We need to engage with them and see whether there's any spikes, and if so, where are these people coming from? Because WASH people need to address those issues. Another area where WASH and health work together is on health promotion. Hygiene promotion and health promotion are related. We're often using the same kind of people, but they are two distinctive activities. Coordinating our messages, coordinating our training, and coordinating where we deploy our people, that's a really important area for health and WASH to work together. When it comes to shelter, there's an obvious collaboration there because all homes that we build in the Red Cross movement do need to be provided with both water and sanitation. We really want the water and sanitation component to be implemented by a WASH professional. So we want to see shelter and WASH people working together. We want to see them working together because these are really specific things, toilets and water supply. And as I've said over and over and over in this video, WASH projects, WASH activities need WASH professionals. Nutrition has a huge component of WASH in it. People who are receiving nutritional support, either in feeding centers or other forms, if they don't have good WASH facilities, research is very clear on this, those nutrition interventions will not be very effective without a strong WASH component. We need to be doing WASH in the same place, making sure that the people we're serving with nutrition activities are also being served by our WASH activities. We obviously work very strongly together with the relief sector, whether that's commodities or cash distribution. We in WASH have a very important role in coordinating with them. What I really want to stress is that WASH teams should not be doing distributions. Our relief teams are experts in this. There's a lot of security concerns around distribution of commodities and goods. The WASH people are not necessarily trained on that. What I want them involved in is in both the planning, and I want WASH teams at the distributions doing hygiene promotion, doing trainings on those commodities. Our hygiene promotion people are really good at finding out what exactly are the commodities that people need. If they need soap, what kind of soap? What should it smell like? Those kind of things are really important in getting people to use things. Particularly around menstrual hygiene, this is really key, an issue that is often neglected by people, making sure that women have both access to menstrual hygiene materials, the right materials, and have the facilities to use those commodities and to dispose of them correctly. Those are really important areas for relief and WASH to work on together. If there is going to be a cash distribution, WASH and cash need to be talking about the so-called basket. I think this is a really good place of interaction between the relief or cash people and WASH in kind of deciding how much of that commodity basket should be in cash and how much should be in goods. What do people really want? And perhaps most important, how can we work together to make sure that people get the right things and use those really important hygiene items, particularly soap, which is so critical in preventing diarrheal disease outbreaks. Those kind of discussions should be happening as soon as possible. They should be happening before the distribution. And when we're making decisions, it's just important to walk across the compound and go find your counterpart in cash and talk to them about this as soon as possible. So in talking to you about all the different resources that are available to WASH people in emergency response, I think the main thing I want to tell you is you're not alone. You've always got someone on the other end of a phone or email who is there to help answer a question, do some research for you, provide you with additional resources. We're always there to help. The best place to go look for this is at our website, www.watsanmissionassistant.org. That's Watsan Mission Assistant, all one word. You can find every single Red Cross publication around water and sanitation, and including resources and publications from other organizations. You'll also find contact details for the WASH team in Geneva. Do get in touch. Whatever you need, we're there to help.